Welcome back to the Move Better Project here in beautiful Vancouver, British Columbia, out on our front deck here. Me and my man Frank Netter are going to talk today about hip extension and really the concept of distinguishing between hip extension and lumbar extension. This is something I've talked about with so many of my patients as well as my training and strength training clients over the years, and it's just a really essential distinction, being able to understand the difference between hip extension and lumbar extension, to understand lower back, hip, and lower extremity function as well as dysfunction. So many of the problems that people have, especially in the modern environment where we spend a lot of time sitting, a lot of time in a shortened hip position, comes from the inability to extend the hip. So what I'm talking about in terms of what it looks like is, this is an example of hip extension. I'm just pulling my shirt tight so that you can see my lower back and the shape that it's in. When I extend my hip, I should not have too much movement in the lower back. There's not a lot of movement up here where my hand is. The movement is happening down here. So this is where the femur, from this angle, my right femur looks like this. It's a big, thick bone, and it kind of takes a turn, and there's a big ball that sticks into a socket in the innominate bone, which is part of the pelvis here. So when I extend my hip, that movement is happening down here. What we see in terms of dysfunction, a lack of hip extension, whether it's due to active insufficiency, your butt muscle, your glute is not strong enough, or passive insufficiency in terms of your hip flexor muscles are too tight. What that looks like is, if I can't extend through the hip, I'm going to make up the difference by extending in the lower back. So then I get this hinge point up higher, and that can cause all kinds of problems. You should be able to actively extend your lower back. That's an important part of mobility, but it should not be the main thing that you use to gain extension, whether that's lifting an object or coming up to a standing position, whether that's walking. Every step you take, your femur your foot has to get behind your body. So if that's happening through hip extension, that's going to be more effective over a long period of time than that happening through lumbar extension. So if we come in here, let's talk a little bit of anatomy. So this is the bony anatomy here, and down here, this is my hip joint. So there's the femur, there's the ball sticking into the socket, which is called the acetabulum, and this is the innominate bone. It's made up of 3 smaller bones, but that doesn't matter. That connects via the sacrum, and these are the SI joints, into the lower back and the lumbar spine. So if you have not enough movement here, that difference is actually going to get made up 1, 2, 3 or more joints away up in the lumbar spine. And just to point out some of the muscles that can cause problems in terms of limiting hip extension, this is a view of the posterior abdominal wall. So if we take away all the guts and vital organs and stuff, these are the muscles that are on the back, basically the front of the back, if you will. So this is the psoas major, that's the tenderloin on a cow, but on a person, it is part of the major hip flexor complex. So that attaches to L2 through L4 mainly, but it can be a little bit higher. And so that muscle joins with another one, this one here called iliacus, and that crosses the hip joint. So when those muscles shorten, when they pull, they create hip flexion. So this movement here, right, flexing at the hip. But if I spend all day sitting and I'm not getting enough of that active hip extension, I'm not training, I'm not using that, these muscles will get shorter. And when they pull on the front of the lower back, and guess what that looks like? If my hip flexor is too short, it's going to pull me into lumbar extension and anterior pelvic tilt. And that's one of those positions that can cause us a lot of problems. And if we come back in here, I got one more muscle to talk about in terms of potential limiting, and that's the rectus femoris muscle here. So this is one of the 4 quadriceps, but it's the only one that crosses the hip joint. That's why it matters. Because when that muscle is tight or it gets short over a long period of time, then again, it's going to pull downward on the front of the pelvis and create lumbar extension, this anterior pelvic tilt, this missing hip extension, whether that's statically or dynamically with every step that you take. So in terms of solutions, there's going to be a whole series of videos that are coming up in this vein of what do we do about it? Well, in short, to summarize, we got to stretch or lengthen or do some foam rolling or soft tissue work or some manual therapy or something. We got to give some kind of a stress to the body to tell these muscles in the front, rectus femoris, iliacus, psoas major, to chill and lengthen and be able to support a neutral pelvis position and allow me to actively extend my hip. So that's part one, and then part two is we got to strengthen the other end. We got to strengthen your glutes, your butt muscles, which when contracted will, boom, they extend the hip, create a posterior pelvic tilt, and kind of cancel out all of that forward, lumbar extension, anterior pelvic tilt positioning that's created when we sit too much and we don't get enough active hip extension. So that's just basically a summary of what the problem is for a lot of people in terms of missing hip extension and distinguishing what that is, hip extension versus lumbar extension. So I hope that makes sense. All right, I'm gonna leave it there, and then this will be part of a playlist, and after this there's gonna be stretches and strengthening exercises to help you deal with this missing hip extension problem that many, many people in the world today, everybody who sits all day, which is most everybody, deals with. All right, thanks, see you next time.